We're entering into the phase of the conference where we're really calling on you all to go to work together, connect up with people, make all of this come alive. You've just had a tremendously high quality morning up till now with Steve Esty and with this really magnificent panel of experts on measuring things. We're in a position where we can measure progress or lack thereof. We can prove what many of us believe to be true but perhaps have never had the numbers for. And we have collaborators in government who want to help us do that and at the Human Rights Commission. So we're in a very good place and we really need to take advantage of it. So the next presentation's very short. I just want to map out the rest of the morning so people know what's coming. Emile and I will present on the proposed implementation process. That is the kind of roadmap. Pretty short. Then we'll introduce, very briefly, the parallel sessions. And we felt it was important to end this morning plenary with a vignette about somebody who's been facing some challenges, made their way through, and that will be Catherine's story. After the vignette, we have to break the room down again into the three, and there will be 3 parallel sessions. These will be quite a bit different from yesterday. Yesterday was information exchange around some really key planks of our strategy, but today will be the 2 main pillars of the strategy, that is disability-confident workplaces and comprehensive supports, plus the partnerships issue, and we will really be going to work on the initiatives within each of those and hoping that a lot of you will commit to work on those initiatives. But again, as I said before, if you're not ready to commit, if you're still looking into things, there's no pressure to nail yourself down to something. We're just trying to move ahead the best we can, and you can make your decisions later on as you wish. So there'll be a break of half an hour before those sessions. The sessions will then happen, then there'll be lunch, and then a report back, and a further opportunity to work on those initiatives. So we're really hoping, with a lot of working time among the group here, you'll make those connections, make those commitments, and give us the confidence at the end of the day that we're moving forward, strong together. Lots of links made, maybe that weren't even in existence before this event. So I'm going to present the first little bit of the implementation process, and then we'll turn it to Emile. So we've had a lot of discussion of the challenge we face. The implementation is voluntary in the sense that we're sitting here and we're not the government. We can't say that every single part of this strategy has to be done by somebody. In some cases, that's possible, but in most cases, it's going to be voluntary. That's a big challenge. But we're really emphasizing, and I know there are folks in the room worried about it being voluntary, that it encourages governments at different levels to work together and with other stakeholders toward achieving the vision. And down the road, there'll be areas which now are voluntary, where there may be legislation at various levels. And one example you had yesterday was accessibility legislation. Regulations are coming. Those are enforceable. They're going to be real on the ground in the federal sector. However, it is going to be up to individual governments to determine what they do. Also, while it's a voluntary strategy, we already have existing legislation in place to provide guidance. We just had a presentation from the Canadian Human Rights Commission. There are laws there. There are ways to enforce them. Those exist now. And the same applies to a lot of areas of human rights across Canada. And in many other areas, something very similar would be our workers' compensation legislation. There's a lot sitting there right now that is going to give some real muscle and strength to this strategy. Just because it's voluntary overall doesn't mean that doesn't exist. And we list a few of these here. CRPD has mechanisms in it that Steve described, and so on. There are also a lot of other strategies. There are so many moving pieces. Housing, poverty reduction, etc. and we're calling on a disability lens to be applied to them as well. So there are people doing things that aren't specifically naming disability, but highly relevant to what we need to achieve to give everybody a full, included life in this country. The tracking. Partnerships are going to be extremely prominent in what we're doing, and just tracking and reporting on them is going to be challenging. Later on today, we're going to be identifying some key partnerships that need to be established or strengthened to address some of these initiatives. We have to ensure all stakeholder groups are represented, in particular, groups of persons with a disability who may be especially vulnerable due to intersectional factors. And I think in the room here, we've had a lot of discussion of that. It's not just a disability. There may be other factors that make you particularly vulnerable and particularly important that your voice be heard. And we need today to identify organizations and people who can take action, and we've all been talking about that for almost a day and a half now. We've got a graphic that was developed, I think it started with Maureen and was elaborated by Institute for Work and Health, and it's an attempt to explain what this is all about. And you'll see that the two pillars, the absolute foundations of this, are disability confident and inclusive workplaces and comprehensive supports for persons with disabilities, seen through an intersectional lens, seen through a life course perspective, with the person with a disability at the core of it, supported by partnerships, core values, guiding principles, and by evidence-based approaches. We want to do what's been proven to be the most powerful initiative to make this all happen. So I'll turn it over to Emile, kept within my time, and he'll be finishing off the presentation.
Okay. I think I meant just more loud. Oh, we're a bit soft-spoken. Okay, sorry, challenges. So there are some challenges with this, obviously, and we need to be cognizant of them so that we can confront these challenges. So real change obviously requires engagement of multiple players in the public and private sector. So just getting everybody together at the table like we have today is a big challenge in and of itself, but really critical that we keep that dialogue going across all of the stakeholder groups, federal, provincial, regional groups. It's really, really important to keep that dialogue going. The strategy is multifaceted and voluntary, creating complexities in the implementation process. And as you can probably see from all the things we've discussed over these last couple of days, there's lots and lots of layers to it. So really critical to think about that big picture, but also all the strata within it, and make progress in all of those strata, but always think about that bigger picture, that gold standard I mentioned earlier on. Okay, so federal, provincial, territorial, and municipal jurisdictional issues bring further complexities, and we're all very cognizant of it. Tabitha mentioned it as well. You know, there's some provincial level stuff, some federal level stuff, human rights at both levels, disability support programs at those various levels. So really need to think about how we can do a better job of coordinating that package of supports that comes across all of those jurisdictional levels, and actually the legislation also that covers across those federal and provincial divides. Some proposed initiatives may require further review. So, and that's what we're here today. Some of the breakout activities that we're going to go into shortly, we'll be trying to detail some of those activities and initiatives, get your insights on how we can make it happen. What's the process to get to that outcome? Okay, while the business case is strong, savings will be realized in the longer run while investments are needed now. So that's a big challenge. We want to think about the big picture, the long run benefits of being inclusive and accessible, but there's some investments that are really needed now in order to make that happen. And we have to always think about that long run picture. It's worth the investment now to make it happen over time. So those are the challenges. In terms of ensuring progress, we want to ensure progress is made to reaching the vision and objectives through measurement, monitoring, and evaluation. So much of what we talked about in that earlier panel, and that was just at a higher level, at the national level. There's obviously monitoring, measurement, and evaluation that needs to be done at various levels and stratas to make sure we're making progress. And here are some suggestions we had gathered during our consultations over the last year from various people who participated in the consultation. Some suggestions on measures that we need to think about, like developing baseline measures of the current situation and record how the situation changes over time. Measurement is critical, and where we're starting at needs to be identified so we can see if we're making progress over time. Measure the current state of employment for persons with disabilities by type of disability. So, really think about the different lived experiences, and it's not a one-size-fits-all, so we have to be cognizant of the various life experiences that people have in different social locations, and think about that intersectionality approach as well. Measure awareness of services and supports among persons with disabilities and access to services, supports, and information. So just the knowledge and communication of what's available to people needs to be identified. Is there awareness of where to get the supports that you need when you need them? Estimate lost productivity associated with barriers to employment and evaluate what works and what does not, such as financial incentives. So the first one is about some of the work I showed earlier on, where we looked at what the potential is of increases in productivity if we were more inclusive and accessible. And if we do that kind of monitoring and evaluation on a periodic basis, we can really make sure that we're making progress in improving the potential of the labor market through being inclusive and accessible. And then what works, what doesn't, such as financial incentives. There's a battery of different areas that we really need to drill down on policy levers such as financial incentives, wage subsidies, and have a better understanding of when they work well and how they work well and when they don't work well, and what we can do to improve those situations. So measurement, monitoring, and evaluation requires partnering with institutions that already collect this data. For sure, we have to do that. I mean, there's great data available from Statistics Canada, and ESDC also plays a big role in that data collection. There's provincial level repositories of data with different program administrators. We really have to tap into all of those people who are collecting data, because we really can't think about collecting it fresh from the get-go. We really have to build on what's already out there and available to us. Key forums for dialogue. So continue the federal, provincial, territorial policy roundtables. I'm not sure if you're aware of it, but we have been doing federal, provincial, territorial policy roundtables every year along with this national conference, and hopefully we can continue to do that, to get that dialogue going and continue that dialogue with the federal, provincial policymakers, administrators, and make sure that they're working together. Continue the annual DWC conference to bring partners and stakeholders together. So what we're doing here today and yesterday, and we've done for the last 2 years, is something we'd like to do on a regular basis to make sure we have this opportunity to come together, assess where we're at, what we still need to do going forward. It's a really great forum to have dialogue with a number of different stakeholders and bring everybody together so that we can think about what we still need to prioritize going forward. These serve as forums to assess progress and plan for the way forward, as I mentioned. So implementation progress should be documented in an annual report that are presented at annual conferences. So this is an idea we had of actually doing an official report to say, what have we accomplished over the last year? Where do we still need to think about making some inroads into? And if we do it on a formal basis, that'll be available not just to the audience here, but more broadly to Canadian society. Knowledge development and mobilization. So here's a critical one. We've been talking at various forums today and yesterday, creating a center of expertise or a network hub to assist with the development and promotion of evidence-informed tools, resources, and service delivery models. So really having a place to go to that can provide some evidence-informed understanding of what works well and what doesn't, what tools are out there for us to use. So it could also provide links to these tools and resources and service delivery models so that it's a one-stop shop for people to go to get really useful information and tools. Provide links to supported employment and other service providers. Sometimes employers struggle to know, where do I go to get the help I need to become disability confident? So this could be a place where they could, a first portal entry to identifying those services. Identify knowledge gaps regarding what tools, resources, models, are effective in different contexts. So really, again, adding to that evidence-informed understanding of what works and when and where. Promote inclusive design, monitor progress on the strategy and related activities, and facilitate partnerships and connections around specific initiatives in the strategy. An important thing for all of this is really funding. Really, ongoing efforts are needed to ensure that funding for the various elements of the implementation are available. And in particular, funding is needed to support active engagement of persons with disabilities in all activities. And that's really critical. We really can't do it without the resources that we need to make it happen. And that's it for me.